First, let me just say thank you all for being here. This is a very, very important announcement for the city. Let me first acknowledge our elected officials and those who are representing others. I know there's either a representative from Senator Ben Cardin's office, Senator Chris Van Hollen's office, Representative Elijah Cummings, Representative John Sarbanes. I believe some of our county executives are supposed to be here or represented at least, which would include Kevin Kamenetz, Stephen Shu, Alan Kittleman, Barry Glassman, and our own Baltimore City Council persons and our president of the City Council, Mr. Jack Young, who has just been such a great partner in my efforts in terms of leading our city forward. I am so excited because this is work that must be done, work that is being done. I see the head of the Office of Employment Development here, Jason. Thank you so much as well. Mary Pat Clark and all the other council people who are here as well. Who else is here? Eric Costello.
John.
Thank you. John Bullock. And I see Robert Stokes is here. I see our Vice President of the City Council, Ms. Middleton is here. But I'm really grateful because we can't do this work alone. I think I said this a little bit earlier. This is a very important key health initiative for our city. Opioid crisis, as many of you know, has just reached an epidemic. And it's not just Baltimore City. And that's why we asked our other partners to join us. This is a problem not just in the city. It's the state, it's our surrounding jurisdictions, and it is a problem nationwide. This is also an international problem. And I can tell you that when you walk the streets of many cities throughout this country, you see it. And the important part of this is that folks are stepping up to the plate. Last year, some 2,000 plus people died of opioid overdose right here in the state of Maryland. 700 happened right here in Baltimore City. And so if we don't think that that's enough to call attention to this issue, then we're kidding ourselves. I want to also thank the Governor's Office, Clay, for being here with us because we can't do this work without the partnership that we have with the state. This particular issue is around Noxalone training and kit distribution program, which trained some 5,037 individuals right here, distributed some 4,198 kits, and documented over 303 overdose reversals through the Baltimore City Health Department's needle exchange program. BCHD recently received another $200,000 in new funding to expand stationary and mobile needle exchanges. I heard a report yesterday. Every morning at 8 a.m. we meet at the police department around our violence reduction initiative, and the health department is a part of that. And they talked about the increase in the number of individuals that we've been able to save through this program. The Baltimore City Health Department has developed what we call a very comprehensive three-pillar strategy to combat opioid addiction: prevent deaths from overdoses and save lives, increase access to on-demand treatment and long-term recovery support, and provide education to reduce stigma and prevent addiction. Everybody knows somebody who's been touched by this, we call it disease. It is a health crisis. And so to the extent that we continue to work together on these kinds of efforts, I think it will change the outcomes for so many other individuals. I'm glad to be here today with representatives of CareFirst, Blue Cross Blue Shield. We know that CareFirst is the area's largest health insurer, but the company is also one of the biggest corporate philanthropists in the region, and the company and its employees are active in so many different ways in our community. I get to call them by their first names, like I say, Chet, Marie, because they are not just individuals who care about our city, they are our friends. Under Chet's leadership for the last decade, CareFirst has been a dedicated partner of this city, a big supporter of our successful Be More for Healthy Babies. And I remember being in a meeting with Marie, and she said, you know, if you want a strategy for how you tackle problems, look at how we've implemented and expanded Be More for Healthy Babies and the impact that it has had on our communities. It is not surprising that CareFirst is stepping up once again to the plate on another important health issue. The need to treat and combat opioids and substance abuse is a big issue in our city. And I can tell you, when we think about violence reduction, this has to be a part of what we're doing. They take it very seriously, and we're excited that they are a committed partner in this effort. And as you can see by the folks' names that we call, it's not just about Baltimore City. It's about how this large institution wraps its arms around organizations throughout the state of Maryland. I'm talking about the various regions. They're not restricted to Baltimore City, because they know that if the problem is here, it's spilling out somewhere else. And if it's over in Anne Arundel County, it's spilling over here. If it's in Howard County, it's spilling over here. Harford County, the same thing. Baltimore County, the same thing. And that's why we have to be partners in this effort. So I see our controller, Joan Pratt. You can come on up and join us. But let me just say, Chet, I can't thank you enough. I can't thank your company enough for being as committed as you've been over the years to Baltimore City, but more importantly, connected to the future of our city. And so I'd like to take a moment to welcome you, and you all give Chet a big round of applause. I know he's trying to leave us. We're trying to hold him down, aren't we, Marie? We're trying to strap him down and keep him here. But we're proud of you, Chet, and we're proud of the commitment of Care First. Thank you.
Thank you, Mayor Pugh. I'm very pleased to be here with you today. This is a topic, no one could say it better than the mayor, how important it is. We cover in Maryland 2 million people in private insurance. I would say that 250,000 have some experience with prescription opioids, and thousands are at risk for addiction. So it's not an issue that is in any way isolated within the population. Just to say a personal story, my son had an accident this summer, was in extreme pain, was given oxycodone, and that lasted for several weeks. And I can tell you that coming off that, not only did all the pain come back, but the withdrawal at that stage was enough in watching him go through that to convince you that it is very easy to become dependent and addicted. He is not, and we fought through that, but you could understand how somebody, even in a situation like that, faces a risk. So we have taken a number of steps. We have taken steps with our formulary. We limit prescribing to certain durations and to certain limits in order to avoid dependency. Now, if somebody really needs it, we can pre-authorize it, but we want to be super careful in that regard. One of the pictures that sticks most in my mind, and I would encourage everybody to think about it this way, if you took a vial, no bigger than that, and took a little bit of that vial, that's heroin enough to kill you. If you took the same vial and looked like a few grains of salt, that's fentanyl, that would kill you. And that is underscored for me just how dangerous it is. What we found is people call in to us from all walks of life that we cover, and what we needed was a way to intake, understand their need, and then they often struggle to get access to the provider that they really needed. And so we developed an intake and an assessment process. We also developed a network of recovery centers that would be immediately available if the need arose, and we connected with those centers and have carefully been building that. We found also that people with regular insurance coverage that have deductibles and out-of-pocket expense often don't comply with what they have to do because it comes out of their pocket. So we took and developed a program to waive the out-of-pocket expense once you're in a recovery program and that you comply with it. One of the things that has really, I think, struck me is intensive outpatient programs are critical to the success of patients at risk. And then oftentimes as much as a year following with community-based services that is critical to have available and to comply with in order to assure that somebody is truly recovering. So we have taken a number of steps, all with a goal towards helping with this problem, societal problem. We then said there must be an array of good ideas that we could help catalyze. And so what we're announcing today is $1.5 million grant over a 24-month period to work with a panel of experts. We will issue an RFP, a request for proposal, working with a panel of experts to solicit what would be considered the best next ideas. What are they? How would one assess them? And then how would you implement them, whatever those ideas might be? We will intend to issue this request in the first part of next year and make a decision by the spring of next year, and then be about helping to implement it, hopefully shining a light on the path forward for all of us. One of the people who helped me understand what it means and how difficult it is to reach this population and serve it is Dr. George Kolodner, standing right behind me. He was the founder, moving force behind COMAC, which is a recovery center that we work with. And when we find people in need, direct to him and others. And I'd like to ask George to come up and say a few words, because it was through him that I really began to have my understanding expanded about what it takes to deal with this population. And he's been doing it since 1973. So, George, please come up.
Thank you, Chet. I'm really pleased to be here today to take a few minutes to say a few words about intensive outpatient treatment. As far as I know, this is the first event to publicly promote this treatment approach. CareFirst has always been an active supporter of intensive outpatient, and I want to thank Chet and the medical director of CareFirst, Dan Wynn, for further extending this support by organizing this event and this initiative. Drug and alcohol rehabilitation programs work by providing intensive structured group therapy to patients who are abstaining from substance use. The treatment was initially restricted to inpatient settings, but because of progress in the use of medication and abstinence monitoring techniques, rehabilitation can now be done on an outpatient basis. Delivering these services in an outpatient setting provides the same level of effectiveness as inpatient treatment without taking people away from their homes and jobs. Work is done on managing day-to-day stresses in a real-life environment rather than in an artificial protected one. The advantages of outpatient treatment are enhanced when it's preceded by outpatient detoxification and followed by less intensive continuing outpatient treatment. By providing all three levels in a single facility, premature dropouts can be reduced, especially if the treatment phases are designed so that they overlap. This approach not only avoids the initial disruption of inpatient treatment, but also eliminates the reentry transition problem that occurs when people return to their homes after they're discharged from the inpatient treatment facilities. This is particularly important because the chronic nature of substance use disorders makes continuing treatment at a less intensive level of care critical to successful long-term recovery. The lack of follow-through after inpatient treatment is disappointingly high, leading to relapses, repeated treatment attempts, and sometimes death. Expanding access to intensive outpatient treatment is particularly relevant at this time because of the challenges presented by the continued opioid addiction crisis. While concerned voices call out for more treatment beds, I would suggest that more people can be treated effectively if funds were directed toward outpatient rehabilitation instead of toward more inpatient treatment. 4 patients can be treated in an outpatient rehabilitation for the cost of 1 patient treated on an inpatient basis. Inpatient treatment is a necessary level of care for a limited number of patients who require more physical containment, but using it as a default first option for everyone is unnecessary and wasteful. I'll end by mentioning that the intensive outpatient model originated right here in Maryland. The program was designed by myself and my colleagues in 1973 to operate during evening hours to especially meet the needs of working individuals. We later broadened the program by adding morning hours. Over the past 44 years, I've spent my entire professional career working to improve this treatment model and have overseen the treatment of 30,000 patients at COMAC. The intensive outpatient model has now become mainstream, and programs are operating throughout the country. Studies have documented its equivalent effectiveness to inpatient rehabilitation. Despite all the advantages provided by outpatient rehabilitation, however, this treatment approach is underutilized. My hope is that this Care First initiative will stimulate and increase use in its use in facilitating recovery and saving lives. And so I'll close by thanking you all again for your support.
I was going to ask the president of the City Council to come up and also offer his thank you, but I also want to acknowledge our Senator Oaks, also Public Safety Chair Brandon Scott has joined us, and also Delegate Bilal Ali has joined us as well. Mr. President.
Thank you, Madam Mayor. I want to thank Care First. I want to thank all the partners for bringing this opioid crisis, to the forefront. At city council meetings, we announce how many, murders in the city, and also make sure that we emphasize the number of opioids deaths that are taking place, not just in the city, but around the state. And I just want to thank everyone for their cooperation and thank the mayor for her leadership and bringing people together. This is the second opportunity that I've been able to stand with the mayor, where she brought together, she talked about collaboration a lot, where everyone around here is collaborating to try to help bring about healthy citizens and reducing crime in Baltimore City. So again, Madam Mayor, thank you.
Thank you, Mr. President. A number of city agencies are here. I see Pete. Thank you so much for being here. Our Chief Operating Officer, DPW, Mr. Chow, Head of Public Works, and I mentioned Jason earlier. I know there are a number of folks out here, so I'm not going to call everybody's name, but let me just say this to you all. It is about partnership. And I think what we're showing today is that we can work with the philanthropic community, we can work with the business community, and rest assured that when you put your money in our hands, we're going to make sure that it gets used. We also will open up soon our own stabilization center right here in Baltimore, because there are folks who are just wandering and they need help. And so not only do we want to stabilize them, we want to push them in the right direction. And I think earlier you heard about some programs that are focused on how we deal with the 17 to 24-year-olds. But Care First, I cannot thank you enough for these funds, for this attention, and for this collaboration, and the collaboration that will take place as we continue to move forward as a state. Thank you so much, and city.